Since January 1st, the United Kingdom is no longer part of the EU internal market and the EU customs union. And this is fundamentally changing the relationship between the EU and the UK. Brexit will also bring far-reaching changes to the movement of medical technology products. After lengthy negotiations, the transition period after Brexit ended on December 31st. The United Kingdom and the European Union agreed on a partnership agreement that will regulate social and economic coexistence in the future and brings the British the independence they want. The agreement comprises almost 1,250 pages and is essentially based on a free trade agreement that does not provide for tariffs or quotas and thus avoids significant trade barriers, says a statement by the Federal Ministry of Health on the future relationship between the EU and the UK. And it ensures the uninterrupted supply of medicines, vaccines and medical devices to the population. Among other things, the new agreement provides for regulations to avoid technical barriers to trade with regards to standardization and conformity assessment procedures, and that includes medical devices. Nevertheless, Brexit has far-reaching implications for European medical device manufacturers who want to sell their products in the UK. In future, they will have to register all medical devices with the Regulatory and Supervisory Authority for Drugs and Medical Devices, the Medicines and Healthcare Products Regulatory Agency, the MHRA. This includes medical devices of risk class 1, IVDs, and custom-made products. For all other medical devices sold in the UK, there are transition periods for MHRA registration depending on the risk class. Another transition period here. In addition, British notified bodies are no longer allowed to issue CE certificates since December 31st. For medical devices of classes 2A, 2B and 3, however, these certificates are a prerequisite for access to the European market. Conversely, the CE marking for medical devices in the UK is only valid until June 30th. After that, the new UK CA labeling, which was introduced from January 1st, is mandatory, explains Stefanie Eich, customs expert at German Trade and Invest in Bonn. Northern Ireland has a special status. The EU medical device regulation according to MDR and IVDR continues to apply here, and the use of the CE mark also remains mandatory. The new UK CA mark for Great Britain is currently based on the same technical requirements as the CE mark in accordance with UK MDR 2002. Changes that come into force with the new regulations, MDR and IVDR from May, will no longer be incorporated into British law. The UK CA marking can be used voluntarily until the transition period expires, says Eich. If certification by an external testing agency is required, this can only be issued by a notified body based in the United Kingdom. And I said the previously notified bodies, the UK notified bodies under EU regulation, automatically become so-called UK approved bodies. For the European manufacturers of medical devices, the new regulations as a result of Brexit mean higher administrative work and costs. But the British medical technology market remains attractive, says Mark Leinfeld, who works for GTI in London. As the third largest sales market in Europe and the sixth largest in the world, it will continue to grow over the next few years. For 2020, analysts estimate the volume to be around 11.2 billion euros. Around 3/4 of British medical technology requirements are covered by imports. Over a third of this comes from the two main supplier countries, the Netherlands and Germany. However, trading goods and services through the English Channel will be more difficult and expensive for businesses on both sides. Even if there will be no future tariffs, quotas or quantitative restrictions on goods imported into the UK. Despite the agreement, bureaucracy and border controls are a burden on trade, as UK companies have to declare their goods to customs before they can cross into the EU, and vice versa, of course. Jörg Meyer, managing director of the Spectaris Industry Association, sees this as a gamble potential. In order to cushion trade barriers for the heavily export-dependent companies in high-tech industries such as optics, photonics, analysis, and medical technology, customs procedures with as little bureaucracy as possible are needed on both sides of the border. For medium-sized companies, new processes with high resource expenditure are often an obstacle to market entry. The free trade agreement that has been now adopted and still waiting ratification on the EU side supports mutual harmonized market access. However, the fact that no agreement could be reached on a comprehensive agreement on future trade relations means that the regulatory costs will be more significant in the future, said Meyer. And he means for the medical part, I guess. This in turn leads to planning uncertainty, less competition, and ultimately to rising prices for the end consumer. The BV Med managing director, Dr. Marc-Pierre Möll, said about Brexit, "It's important for our companies that there's a transition period until June 2023 for CE marked products, according to MDD and MDR. There are still numerous unanswered questions about the design of national regulations, for example, the future registration of medical devices in the UK." BV Med continues to campaign for a mutual recognition agreement for medical devices between the EU and the UK. They say, "We see good opportunities to negotiate an MRA specifically for medical devices because in this area you already have a common starting point with the requirements for the CE marking, and unlike with other approval systems, you don't have to negotiate compromises. Because it is a priority for both sides to prevent duplicate conformity assessment procedures. It is equally important to ensure access to clinical data under an agreement. Great Britain currently has the most transparent real-life care data from which data can be used as a basis for health technology assessments. They say. Data is a very difficult subject. We talked about the GDPR recently. We're gonna see. And if you want to stay informed, please subscribe to my channel and to my other channels. I'll see you on my next video. Auf Wiedersehen.